Outpatient total joint replacement surgery is when a patient goes in either to a hospital or surgery center, has their joint replacement performed, either a hip or knee replacement or a shoulder replacement, and then they go home the same day. Historically, patients have spent 1 to several nights in the hospital after surgery, but now this is being done as an outpatient procedure where the patient will go home the same day after surgery. So the benefits for most people is, number one, it's safe to do. Number two, they get to go home and be in their own environment, is probably the biggest thing. Over the years that we've transitioned to getting more aggressive with rehab, we actually get people into therapy before surgery and try and get them moving a little bit better before surgery. But it's vital to the recovery after joint replacement surgery to get up and start moving. And that does several things. It decreases risk for blood clots. It also starts to strengthen your muscles to start your recovery process. It is a safe option. Now, there's certain patients that may not be candidates due to medical issues, maybe a social situation where they don't have support at home. But for most people, outpatient joint replacement surgery is a safe option. Most patients will qualify, but it's something that the patient has to feel comfortable with. The doctor has to feel comfortable with them doing that. They have to have a support system so it's safe for them to go home. And functionally, they need to be able to do that. And so we will actually send people to physical therapy and get a functional evaluation before surgery to see if they can physically do that.